None of us can do this alone. Together, we can take on tomorrow. We look forward to joining you in this quest until every child is well.
I'm looking most forward to hearing from the CEOs and really trying to find out, in this coming age, how we can really advocate for our patients, including, with innovation and upcoming changes in healthcare, really how to be a good advocate.
A conference like this is important for a couple of reasons. I think, one, it's important to showcase and celebrate several of the innovations that have occurred at places like Boston Children's and these other amazing pediatric institutions, and to build upon those and bring them closer to treatments that can benefit our kids.
This day is a symbol of the fact that we are thinking hard about pulling each other together to share ideas about what works and what doesn't, and to be more methodical about pushing innovation.
The day's going great. It's been fantastic to be able to accelerate the thought process of what we do, because we've been able to meet with so many people and find this kind of amalgam, which has been fantastic. We've already started to make some really wonderful connections that I think are going to really help move our work forward.
I think the challenges in pediatrics are similar to the challenges across all of medicine. I mean, there's more necessity to coordinate care, make it more efficient, take the most advantage of the extremely limited time that everyone kind of trying to provide care has.
Always having a great desire to change make a difference in the way the world functions, and using our intelligence of our technology and our capability to make a smarter planet. This is a phenomenal opportunity for us to work with them.
Well, I hope to learn a little bit about what my colleagues are doing, Ami Klin in particular and Burgan Kassir, and I hope to sort of get my finger on the pulse of the audience about what they're thinking about autism.
When I first started in this field, we talked about 4 individuals with autism per 10,000. It was a rare condition, very much along the lines of some of the conditions that we heard about this morning. The CDC now tells us it's 1 in 88.
It was wonderful that we were able to bring experts about autism, have different perspectives, and have the conversation with even the audience. I think even as a Boston Children's Hospital employee, I'm not aware of some of the research going on. So I just thought that was wonderful to hear different science and even the business side of where we are in autism.
Well, it's important to provide an opportunity for collaboration, for groups to hear what's going on and to see how they can provide an impact or be involved in the next step in the innovation. I think it's very important. And we work in silos so often, and to break down those silos is very important to really make a difference.
Before, people were innovating in private. Now we're innovating in public, and we're innovating across platforms, across institutions, across nations. And people are only now starting to think about how you position yourself in the world and in your own institution as how to promote innovation.
Everyone takes for granted that we know what that word means. What is an innovation? How do we recognize it when it happens? And I worked with a very smart man for many, many years, Nick D'Onofrio, who told me once that his view of innovation is, simply put, it's the intersection of insight with invention.
The biggest barrier for innovation for us is going from seed round to A round and convincing funding source to help us move there. That's the biggest challenge that we face.
Many fewer dollars are going to life sciences, and in particular to early stage life science. That is really been a particularly challenging area. So there are many great ideas that really have trouble getting funded. It's a very challenging situation.
The majority of the interest is in the genome, cardiac issues, diabetes, MS. How do you deal with some of the other major unmet needs at the front end of pediatrics and bring those to market?
It's not science fiction to imagine that a community health worker out in sub-Saharan Africa could get a pinprick of blood and put it on some optic device and be fed across the world for genomic analysis.
There needs to be a new paradigm and partnership, if you will, so that we can really do this right. And so I'm hoping that a conference like this will give me some touch points that I can bring back to my company so that, for example, if we have to do certain pediatric studies because they're required. Perhaps we can go into a new kind of partnering space where we could actually help do some research with some of the doctors perhaps here in Boston.
I would like to see what impact comes from bringing all of these different kinds of perspectives and different minds together.
In this summit, what we're bringing together is creativity and science. So a curious mind along with the science that where we're building on from today is just an amazing way to improve children's health. And children are the future, and so it's got to start here.